One, we appreciate you being on our committee, and um, so we want to I remember when I read your application, when you applied for the committee, how many years of service you've had. And I'd also would really like to highlight to others what it's like to be one, managing an agency in a rural area, but also promoting pediatric care. And I thought you wrote, a very passionate application. So that's why I created the, rural PEC position for you on the committee. So I'm going to let Caitlin ask some of the questions that we have, and I'll interject every now and then we'll show the recording and we may take some clips of it. And when is your actual last day?
June 28th.
Oh, so we've got a little bit of time. Okay, June 28th. I don't know why I thought it was coming up sooner. So will you be attending the meeting in South Florida or not?
No.
Okay. We are going to have a virtual meeting. I think Caitlin just sent out the invitation in April. So let us know if you can attend that, the April meeting. Okay. And then we'll just say that's your final meeting. But okay, Caitlin, you want to take it away?
Yeah. So we just wanted to start off with just doing an introduction of yourself and your background.
Yes, my name's Marvin Walters. I'm the EMS Chief, Wakulla County Fire Rescue. I've been with this department for 32 years. Been a paramedic for 27 of those years. I've been in EMS for a total of 41 years.
Wow, that's amazing. Would you mind giving us just insight into what a day in the life looks like for an EMS chief and a PEC in a rural county?
Yes, basically a lot of it, we do a lot of review of data, look at multiple different metrics using our ESO platform, especially with regard to pediatrics. We do a lot of research of equipment and try to do the best practices and stuff for pediatrics for our department.
Okay. And why did you decide to become a PEC?
I feel that's like one of the most important patients that we have contact with, simply for the fact that they are not like an adult. It's a unique population, and we do have a low acuity opportunity to treat pediatrics. We don't have as many as those, and I want our people to be the best at taking care of our pediatric population.
That's great. And did you receive support when starting your role as a PEC? Oh, you're good.
So
Did you receive support when you began your role as a PEC?
yes. Um, Through the committee and also the website. The website was a great resource for us, being able to connect with the national level as far as pediatric care and stuff. Also, their reviews of pediatric equipment as far as the safe transport, stuff like that was a great resource for us.
Thank you. And what has been the most challenging aspect of being a PEC or providing pediatric care, specifically in a rural county?
A lot of it has to do with financial restraints of a smaller county. We try our best to do grant opportunities to acquire equipment, but that's the major thing is financial.
Okay. And what has been the most rewarding aspect being a PEC and providing pediatric care in your community?
The most rewarding thing is actually being on the committee and interacting with Dr. Henry and other members on the committee. And again, the website is a wealth of resources that's really helped us develop different programs and different things for our service as far as pediatric care.
Okay. And I know you kind of touched upon how the website has been really helpful. Are there any other resources that you found to be helpful with your role as a PEC or in just the overall care of children in your community?
That's basically, that's been the driving force as far as our care and stuff for pediatrics, resource wise, has been that.
Okay, thank you. And what advice would you give to someone that's interested in becoming a PEC, but may not be 100% sure about taking on the role?
I would definitely tell them they need to explore the website for sure. Going to state meeting and go to the EMS for Children committee meetings, interact, network with people in that field. And I think it would spark interest for a lot of people. But yes, that would definitely would help, I would think.
Thank you.
Yes.
And do you have a favorite pediatric case that you would like to share with us or others? Do you have a
I'm sorry.
favorite? Oh, you're okay. Do you have a favorite pediatric case that you would like to share with us or maybe others that will see this interview?
Um, no, no.
No,
No.
no
Uh,
worries.
anything that comes to mind where you use some of our resources, like our Jumpstart Badge Buddies or communication cards? Any memories of that?
Um,
Fine if you don't.
no, I can't think of anything right this second. I know that we did use the 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 Furno thing. We did have a patient one time that it was very small child, and we were able to use that device and stuff on the stretcher and stuff, and that was very nice.
Right.
Because that way we knew we was having a safe transport, and it made the care a lot easier because we're not dealing with the mother holding the child and trying to do care. We have them in a secure device where we could do care appropriately. Yes, we did have that. Yes. Yes.
Right. Okay, Caitlin, I'll ask some of the last questions
Yeah.
and give you a break from talking. So, in your role, my question is, how many staff do you have? I know you said you kind of do it all. You're the chief, you're the PEC. How many staff do you have?
We have 60 staff members, 60 employees altogether. Um, we're in this transition, we're transitioning with the transition. They're actually changing the title and the responsibilities of my position. They're changing it to assistant chief position. So they're going to be over operations, daily operations. And in that too, we've already been discussing about the PEC. That was one of the first things we discussed, is how the PEC would go forward. We have a EMS committee that's comprised of 5 to 6 individuals. Usually it's one from each shift, and then we have some of our battalion chiefs, one over training and one over logistics, that's in that meeting. And basically we was going to probably see who in that EMS committee wanted to be a PEC, or if they wanted to combine efforts, like be over certain parts of the PEC, like one over equipment, one over protocol advancement, and different training and different things like that.
Great. Tell us a little bit. I've actually visited your county, so it's Wakulla County.
Yes.
Is there a hospital in your county?
No,
Okay.
the nearest hospital is Tallahassee,
And how far away is that?
about 24 miles from our main station.
Great. So you've been a leader in your county for a long time, or there just anything else you want to add about just EMS in general? Tips that you've learned or advice you would pass on, or
Always be willing to learn. Uh, don't get stuck in the past. Always look for the future. look for something to always improve the care for all patients. And that's our job, is to be for the patients.
I know in rural counties, so I grew up in a rural parish in Northwest Louisiana, everyone knew each other.
Right.
If you went to the hospital, if you you got a new car, you did anything, everyone knew about it. So what's it like in your county caring for people? You must know a lot of the people that you get called to care for. What is that like?
It's you have a personal connection. So yes, it's the care is very, your empathy is very high because you know this person.
Mm.
And it's family. You know what I mean? Even if it's a friend, it's a close friend. It's like family. So yes, it's very emotional for us sometimes
I
if it's
bet.
real bad.
'Cause you know the person that's been in the car accident or
Right.
had their child injured, things like that. What about so we're really focused on pediatric disaster planning now also. Have you participated in any type of in your healthcare coalition, anything to do with pediatric disaster planning?
We hadn't yet. They've been doing some different exercises. The last exercise we was working on was the chemical,
Mhm.
um, and it didn't have any. I don't remember any pediatric part to that.
Right,
Of course, they definitely need to have that in there.
right. But you are involved in your healthcare coalition. I forgot what region you're.
Yes, I'm in Region 2, the Big Bend
Okay.
Healthcare Coalition. I'm actually the secretary on the board. But yeah, very involved with it.
Okay, great. Let's see what else we want to ask you. Is there anything else that you would like to add about the importance of pediatrics, or just any closing remarks, stories, anything that you would like to share?
I've already said it, but I say it again. I appreciate you. I appreciate the committee. I appreciate the website. I appreciate all the resources that y'all have provided for us and the assistance that y'all gave us to be able to do better for the pediatric population.
Right. Well, one thing is we want to hear from you. Also, our national funder is HRSA, and we work closely with emergency physicians, emergency nurses, EMS organizations. And so we really want the voice of rural EMS to be heard, especially for pediatrics. So I hope you'll encourage those that'll be following in your footsteps to, keep up the pediatric focus and banner. What are you going to be doing in retirement?
Hadn't really decided. The short term is travel, and
Mhm.
then from there hadn't really decided from there.
Do you think you'll stay in your county?
Yes, yes,
That's your home.
yes.
Okay. Well, we really appreciate your time and your dedication. As I mentioned, we'll have a virtual meeting April. So I certainly hope that you can attend so we can, say a formal farewell to you. And Caitlin, do you have any last minute things? Anything else you'd like to add?
No, I don't think so. Just congratulations on your retirement and thank you for taking the time to do this with us.
Alrighty, thank y'all.
Okay, you have a good day and let us know if you need anything. And when you have the name of that new PECC, send us our way.
I'll do it.
Okay. Thank you,
Thank
Chief.
you.
All
Yeah,
right.
thank y'all.
Goodbye.
Bye.
Bye.